let me start by saying, and this is a really important point, that we are not in this alone. That's a good thing. We have terrific partners in government, like the Rhode Island Emergency Management Agency, that's helped us to distribute 250,000 emergency meals. We have terrific partners in the community-based agencies like CAP and the 160 plus member agencies of the food bank. And we have a terrific partner in the United Way and the United Way's 211 hotline. I spoke with the folks at 211 recently, and they let me know that they have seen a dramatic increase in number of calls. Almost every day at her press conference, the governor urges people who need help to call 211. They've been doing that. So I asked folks at 211 just about the calls that they are getting about food assistance. A year ago, in April 2019, they got 2,000 calls in April. And we thought that was a lot. This past April 2020, they got 8,000 calls in that month, 4 times the number of calls. All these people in desperate need of food assistance. And as that many people newly in need of food assistance are coming to food pantries across the state, we have had to do our best to respond and keep up with that rapidly growing need by distributing more food. And just in the month of May that we're ending, we expect to have distributed about 1.5 million pounds of food. In a normal month, we would distribute 1 million pounds, so 500,000 more pounds than normal, just to try to keep up with this demand. And our member agency partners have done an extraordinary job at meeting the need, ensuring that everyone is served, while at the same time maintaining social distancing guidelines. And we'll talk more about that in a little bit. I've often said that hunger is a health issue. And that statement, I think, has new meaning in this context. Many of you helped us conduct a survey about a year ago of people coming for food assistance. And what we found is a high percentage of senior adults, a high percentage of Black and Latino families, that among those served, a high percentage of people in poor health and with chronic health conditions. Those populations are the folks most at risk for COVID-19. So what we're seeing is that the disparities that were clear from our survey of people receiving food assistance are even clearer now and exposed now in this COVID-19 emergency. I know that Rilwan has a lot to say about this. I'm really interested in his perspective. So Rilwan, if you can join me. As I said, Rilwan is the Executive Director of Community Action Partnership of Providence. Welcome.
Good afternoon. Thank you for having me.
Absolutely. Do you want to tell us a little bit about what you're seeing?
It's an interesting time. Who would have thought we would have been at this place and at this time? I have a public health background. It's been many years looking at social determinants of health, looking at food insecurity and many other issues that affect our communities. And never would I have thought we'd be in the middle of a global pandemic at this time. When I left from public health to come to CAP about 8 years ago, we, like so many other folks, saw food insecurity as a major issue for us. Here at CAP, we serve about 33,000 Providence residents per year with a host of services that many folks are familiar with, from rental assistance to helping with heating insecurity to being able to work with seniors. You name it, we kind of touch all of those places. And where we've kind of made our hallmark is trying to provide wraparound services to people and bring people to self-sufficiency. We work with very low to moderate income individuals that every day have to make decisions between food and medicine and all the other things that we commonly see. When I came 8 years ago, we had a very modest pantry that was part of the network and was serving one zip code and continue to serve residents in that area. And over the 8 years, we've steadily increased because the needs had increased. And now are one of the largest service providers or pantries in the Providence area, now 8 years later. What has COVID meant to us and what does it look like for us has been really amazing, Andrew. And I've got to tell you, the network and the food bank is phenomenal. Our member agencies are phenomenal. Many of you know that several months ago, we actually had to close our pantry to relocate it and did several $1,000s of remodeling and moved it to an area in the heart of South Providence on Broad Street, closer to a bus line, expanded it because the needs have expanded over those 8 years that we've been there without question. But what we never expected was, as we were doing our soft launch a month prior, that we would end up dealing with COVID-19 and all the issues that are happening there. So you and I had spoken many times about what we thought the uptick would be just in normal pantry operations in a normal time and place when folks are dramatically challenged for resources, what that would look like. And a month later, after our soft opening, we're in the middle of COVID-19 and changing how we do everyday business. I'll just share with you, if it's okay, food by the numbers for us at CAP. So in the last 2 weeks of April, on the week of April 13th through the 30th, I should probably just step back and say this. In addition to our food pantry, we have operated for a long time a congregate meals program, a very small program in the same space that we use for the pantry. We were serving only about 20 seniors 2 days a week. With COVID-19 and social distancing and executive orders, we had to stop being able to do that program. So literally overnight, it feels like through a weekend, we went from a 2-day-a-week program serving 20 seniors to a 5-day-a-week delivered meal program. Serving in the last 2 weeks of April alone, we delivered 310 lunches to seniors.
Wow.
Out of a program that never existed for us. Through May 28th, May 1st through May 28th, that number has increased to 437 lunches that we provided 5 days a week to seniors. In addition to that, every 2 weeks on a Friday, we give them provisions from the pantry to make sure that they can have access to all the other meals beyond the lunch that's provided for them. So they're getting 2 weeks of food every Friday or every other Friday to be able to get through those times because the demands are that high. So those were not only our seniors, but additional seniors that needed resources both in and out of our zip code, but needed help. Some of those were impacted by COVID and were quarantined or self-quarantining. Others were just medically compromised or were instructed to not leave home because of their age. So organizations like ours and other member network members are just stepping up to kind of fill needs that we never thought we would have to. But what has been really eye-opening as my staff reported on what we were doing in the pantry, from April 3rd to May 20th, we have seen 1,033 pantry recipients come through our doors. Of that, in this last month or so, 601 of them are new to our pantry. We have never seen them, have never worked with them. 601. 200 of them are what we call emergency. An additional 200 are folks that are outside of our catchment area and outside of our zip code area. So they came in because some of our other member agencies or maybe other pantries that are not part of the network that we're providing because of what's going on are not able to stand up and be able to offer the services that they have. And then we had the normal 232 of our returning every 2 week clients. So the need has been phenomenal. And it's been at an unprecedented time for us as we're doing it. So like a lot of organizations, social distancing means less access or availability to our volunteers. What many don't know is our actual staff we're half of our normal staff, and the actual pantry operations staff, through reasons related to COVID and childcare, are not working during this time. So we're actually standing up and manning our pantry with our senior management staff and a handful of volunteers. So from myself to our deputy director, to our HR director, and every manager on team, from deliveries that come in from the food bank and extra food that we buy outside of the network. We are literally all hands on deck, providing and making sure that we're taking care of this now 1,000+ folks that are coming in each month.
Yeah, I mean, it's just an unbelievable story. We thought, when had talked about before COVID-19, we thought that you would have like this gradual ramping up of the, and that did not happen. You were suddenly inundated with people overnight.
Absolutely. It was just amazing. Again, we didn't do a lot of advertising. We had reached out to all of those that we had served previously. In a given year, we were already seeing over 750 families that were coming repeatedly for services and needing that help and support. So we had reached out to them to let them know that we had reopened, and we thought it was going to be a soft launch, but from the days our doors opened, we had an immediate need. And again, this was the month right before quarantine, lockdown, and COVID really started emerging in our state. So we've been all hands on deck and have been working tremendously hard to make sure we meet those needs. We're just really happy that we can say that we've not been able to or have had to turn anyone away. Everyone's getting those basic needs. It's just a great demand at this time.
Oh, you know, you and your staff have just done just such an amazing job. Now, because we're now in this phase where Rhode Island is reopening, I think that there's some impression that the emergency is over, or somehow it's winding down. But do you see that there's going to be any decrease in the demand for food assistance?
If those 601 new clients or residents that we saw in this month alone are any indication, I don't believe so. Again, I think the needs are still critically high for folks. There are going to still be many that are impacted that will need to quarantine or need to be in place for some time. And as we navigate this unemployment situation, as we know, is incredibly difficult in our state. We were one of the last states to kind of recover from the last recession that we had, and have still been working hard to kind of get folks back to jobs and working. We have an awful lot of folks that are still kind of been left behind that have not entered that workforce prior to COVID. So we know that there's going to be extremely high needs for the kind of work and services that the food bank provides and member agencies like mine do to meet those needs. Without question, we're expecting to see more, not less.
Yeah, I agree. And I'm also concerned, a lot of the programs that are in place to help people right now, and government programs that really are helping people, the pandemic EBT that gives families with school-aged children an extra benefit, some of the additional SNAP benefits, those programs are temporary,
right,
and they're going to go away in the next couple of months. And along with the extra unemployment benefits that folks have gotten, those are going to end in June, July, and I'm just afraid that there's just no way that the job picture is going to change enough that we're not going to have another big increase in the number of people needing food assistance.
I agree with you wholeheartedly. Compound that issue that we've had a lot of really good stopgap measures that we've done because we've been in the situation. Add to that the moratorium on utility shutoffs will be ending. Add to that the fact that the moratorium on evictions will be ending. So we're going to have people again in that situation, not only looking at how they provide for medicine and basic needs, but being in arrears for rent over these couple of months of being there. Folks that now have very large bills that are due for utilities that are going to need that support, and trying to balance that with food is always one of those areas that really concern us, especially our young kids that have been out of school. It was the same kind of issue in making sure that they were getting their needs met without the school lunch program. Again, as we move into the summer months, how that looks when we had the summer lunch program. I don't know if we really talked about that or broached out how that's going to look, depending on if we're able to gather in the parks and be able to disseminate lunches the way that we would normally do, or breakfasts to our eligible population. So I think we've got a lot more work ahead of us and a lot more needs that are going to arise, even with the reopening or reemerging of laxing of some of the social distancing issues that we have now.